Hey, my name is Heather Haynes, and today for my demonstration, I'm going to tell you how to start an IV. Alright, so what you need to start an IV is you need your IV start kit, you need your Gelcos, which is your IV catheter, your extension set, an alcohol pad. So first you're going to open your IV start kit and get your tourniquet. And I'm going to tie this on my arm so that I can show you what an actual vein looks like. And then we'll demonstrate on the fake hand I created. This is kind of hard. So you kind of want to put that on there tight to the patient. And if you look real closely right here, this is what a vein looks like. So you would be looking for a vein, you would touch it, feel it, make sure it feels great. And this one does. So then you would, I'm gonna just take this off and we're gonna demonstrate on my fake hand now. So first things first, you would have on gloves. I didn't bring an extra set of gloves, so. You got your tourniquet on your patient, you find your vein. This is my little makeshift hand, don't judge. And then you would clean the area really good and let that dry. And while that's drying, I am usually with my patients, that would sit right there. I don't know how well that's gonna sit, but we're gonna, there we go. While that's drying, usually with the patient, I will take and connect get my extension set primed. Just kind of keep going. So this is just a saline flush. This is what you use to make sure that the line is good and you got good access. You kind of flush it through the vein. So I'm going to take this off just to demonstrate. So that, there you go, that's primed through. And like I said, if I was with a loud patient, I would actually have gloves on. So this here is our IV catheter. Got a safety cap on here so you don't stick yourself. You don't take this off until you're ready to stick the patient, which we're about to do. So I'm going to pull my IV catheter off. I always kind of get a little loose on mine. You got to make sure your bevel of the needle is up, which is a little hole at the top. So you want to stabilize yourself, and everybody has their own little method. But you would take your IV catheter and you would insert it into the vein. This is our vein. And once you insert it, you'll start to get a flashback. And if you see, a flash is when you see blood. Once you're into the vein, you would get blood. It would come into this little port area right here. Once you see that, you start to advance your catheter. When you advance your catheter, your needle is retracted. So you kind of cut off from up here so you don't have a bunch of excess blood coming out. Remove this. This would go into a sharps container. We're just going to pretend that's the sharps there. And then this is when you would add your extension set. And kind of just pull back a little bit to make sure you have blood. And then you flush the vein. The vein's flushing great. I'm not going to flush too much because there's a balloon in there and I don't want it to pop. So once you have your vein flushed, then you secure it with your clear securing device. And keep this little window. Oh. And you kind of loop this around, remove your flush. And you want to take this extension up so your patient doesn't pull it out. And once you secure that, you lock it. And you put your hand don't roll around that much, I can tell you that. You're gonna put an orange cap on top. This keeps this part sterile for you, good and clean. And you remove that before you place that in there. And then you're going to put your sticker on here. And this is where you would write the size of your IV catheter, the date and time, and your initials. And this, my friends, is how you start an IV.
Hey, Madonna.